Imagine looking inside the human body and learning its most intimate secrets, seeing problems as they occur and without having to slice through the skin. Images help navigate the tangled blood vessels of a patient's brain before ever lifting a scalpel. A virtual flight through the human colon locates a suspicious growth without the need for cold probing steel. And a special camera is detecting radioactive signals, tracking down a tumor before it grows into life-threatening cancer. Each of these imaging technologies are opening the door for new cures and better treatments. It's all part of medicine in the 21st century. And it's next on The Image Within. The healing power of medicine begins with understanding what's gone wrong inside the body. As we cross the threshold of the 21st century, high-tech tools for peering deep inside the human body are revolutionizing the way doctors see and treat illness. Three-dimensional images of this man's arteries allow them to stay one step ahead of a deadly disease. A surgeon's hands, aided by the lens of a microscope and the precision of computer images, deliver this man from debilitating pain. And a surgery guided by X-ray images reveals the cause of this woman's mysterious illness.
This is the liver here. This is the aorta, which is the main...
Doctors are looking deeper into the body and seeing more than ever before. For the first time, we can imagine how well the body is working on a molecular level, making it possible to detect diseases earlier and treat them sooner. Seeing opens the gateway to understanding. And with understanding, doctors are finding new ways to heal. Like astronomers probing the frontiers of space, pioneers in medical imaging are always seeking new ways to explore the human body. For more than 100 years, we have been searching for different ways to look inside the body. It started when German scientist Wilhelm Röntgen accidentally discovered he could expose the bones in his wife's hand using a luminescent screen and a glass tube charged with electricity. Thus was born the X-ray, and a whole new way of diagnosing medical disorders. That search continues. Now there's a multitude of ways to visually penetrate the body. The list of medical imaging devices is long, and the technologies varied, from ultrasound, MRI, and CAT scans to PET scanning and magnetic resonance spectroscopy. Still, no technology will ever replace a doctor's need to thoroughly understand human anatomy. Historically, the best way to learn human anatomy has been to cut and dice up the human body. That is, until the National Library of Medicine commissioned a group of scientists to literally take a human body apart and put it back together on a computer, creating an exact 3D digital atlas of a human being. People with the Visible Human Project have done just that, with first a man and then a woman. And they did it without the tissue damage that accompanies surgery, or the distortion that comes from cutting into flesh. 2 cadavers, frozen solid, were donated to science to serve as models for this ultimate 21st century anatomy lesson. First, the frozen cadavers were sawed into 3 big sections. Then, much like sanding down a fine piece of wood, each layer was literally shaved away, from head to toe, slice by slice, millimeter by millimeter. After each layer was ground away, high-resolution CAT scans, magnetic resonance images, and photographs were taken of what was left. These images were then matched together with hair-splitting precision to build an exact, detailed replica of the human body on a computer. Vic Spitzer is one of the visionaries in charge of the project. He foresees a day when scientists will be able to imitate all the systems that make human life possible.
We're trying to simulate life, if you will, and for us that starts out as simulating the anatomy of the human body, and then we add to that the physiology of the human body, and since this is about medicine, we can eventually add the pathology of humans.
As you're twisting it here, it twists that into the plane.
So far, Spitzer and his team of researchers at the Center for Human Simulation in Denver have identified every detail of the visible man's anatomy, a remarkable feat, but only a baby step in a titanic endeavor. Building a blueprint of the human body in the virtual world is a lot like creating a flight simulator to train airplane pilots. This doctor is using the visible human to perfect a new procedure using endoscopic ultrasound to examine a patient's trachea. Inexperienced doctors get to train on a computer before ever laying hands on a live patient.
The advantage to patients in the future, when we really start training with simulation, is that every patient, even the doctor's first patient, gets an experienced clinician. More experienced than they get today. I would like to think that translates into better care.
So, for example, a surgeon operating on his or her first real patient will have already performed that particular procedure in the virtual world. The problem is that no two people are alike, and a couple of visible humans cannot represent humanity.
We certainly want to simulate everyone in the world. But that comes from knowledge and transforming this one man. He's a 39-year-old, 200-pound man. I don't think it'll be that far away when we can realistically transform him into a 39-year-old, 180-pound man, 160-pound man.
With a click of a mouse, Vic Spitzer eventually wants to be able to transform this virtual man into any man, of any race, old or young, big or small.
Goal is to have enough control that we can dial in the person we want.
The clear precision of magnetic resonance imaging allowed scientists to gather enough detailed information to build a virtual human in 3D. The same MRI technology made it possible for doctors to actually look inside Matthew Kelly's weakened aorta, possibly saving his life.
Come here.
Matthew was born with cerebral palsy, but he never let his disability keep him down. Growing up, he worked hard, first to be able to walk, then to build up his body. Although today it's a challenge to lift even 12 pounds, there was a time Matthew was bench pressing 170 pounds.
That was something I was really big into in high school, and I managed to get hurt. Subsequently, my pediatrician had sent me to a specialist to see if he thought I had injured something.
The surgeon did not find the hernia he suspected, but during a physical exam, he did detect a heart murmur. An MRI revealed that Matthew had a ticking time bomb in his chest.
When they did the MRI, they were able to tell, due to that technology, that the wall of the aorta was thinner in the portion where they noted the aneurysm, which, of course, pretty much led them to diagnose the Marfan syndrome.
Marfan syndrome is a rare genetic disorder that affects connective tissue like the aorta, the main blood vessel leading from the heart. Matthew's weakened aorta had swollen up like a balloon. The ballooned blood vessel is called an aortic aneurysm. A sudden increase in blood pressure could cause his aorta to burst and possibly lead to his death. Matthew's mother, Pinky, says she found it hard to believe he had another problem to deal with on top of his cerebral palsy.
It was kind of devastating to us because we thought he had done, had conquered so much. And then here he was, he had a new hurdle to jump over.
Every 6 months, Matthew comes to Johns Hopkins, the world's leading center for the study of Marfan syndrome, for an MRI and a checkup. MRI, magnetic resonance imaging, uses radio waves and a magnet, many times stronger than Earth's gravity, to capture clear, detailed images from any angle in the body. Powerful computer technology allows doctors to combine MRI images into a three-dimensional portrait of Matthew's blood vessels. Because his Marfan syndrome is chronic, Matthew is in constant danger of developing a life-threatening problem somewhere in his blood vessels.
I would have to say, on those days, my blood pressure is probably the highest that it's been for the month. You know?
Matthew is nervous, never knowing what his doctors might find during these visits. Still, he can find solace in the fact the latest MRI technology is helping them anticipate any complications with his Marfan syndrome. The exquisite clarity of 3D high-resolution MRI allows doctors to examine Matthew's entire aorta, inside and out.
We've checked the images as we've gone along.
As his doctors follow him into the 21st century, they hope that these precise, detailed images will prevent the kind of near-death experience Matthew endured 10 years ago. Not long after he was diagnosed with Marfan's, Matthew suffered a nasty fall on the ice. He was taken to Johns Hopkins, but before doctors could find the cause of his pain, the main artery leading from Matthew's heart started to rupture, nearly killing him. Matthew was rushed to emergency surgery. They repaired Matthew's shredded aorta and put in a new heart valve. He has since had 2 more major surgeries to repair the rest of his aorta. Matthew won't be lifting serious weights again anytime soon. Still, he says he's lucky, especially considering where he's been. Lucky an MRI revealed his condition in the first place. Lucky, too, he happened to be in the right place when his aorta began to rupture. Dr. Thomas Trail is Matthew's cardiologist.
Nobody has many patients at his age with Marfan syndrome who've been through what he's already been through. We had him talk to the medical interns.
A generation ago, hardly anyone knew what Marfan syndrome was, much less how to repair a shredding aorta. Recent advances in surgery saved Matthew's life. In the future, faster, more precise MRI will help keep him alive by staying one step ahead of his disease.
What MRI does is move you from modeling through to making the surveillance and the surgical treatment routine. And only when these things are routine do you get really good at them.
Unlike the heart, the aorta is difficult to visualize because it's hidden. MRI takes beautiful pictures of this major blood vessel. And because it's completely non-invasive, scans can be repeated over and over with no risk to the patient.
Let me tell you, from a patient's point of view, anything that allows them to find out what they need to find out without poking 9 million holes in you or putting anything else in you is a godsend.
Go ahead and take a deep breath in.
Literally in a breath hold, we get 3-dimensional images of his entire aorta and the branch vessels off the aorta, all the way down to his abdomen.
Dr. David Blumke says 3D imaging makes it much easier to detect signs of weakness in Matthew's blood vessels. As a radiologist, David Blumke was trained to look at the human in slices. Reading an MRI or CAT scan can be compared to taking a slice out of a loaf of bread. But unlike bread, the human body does not come in slices. It works as a 3-dimensional whole.
In radiology, we're trying to generate images that represent reality, and reality is what the extent of disease process is. And the body is in 3 dimensions. It's not a 2-dimensional world, and we need to present that as accurately as possible.
5 years ago, a 3D representation such as this would have taken up to a week to build and interpret. Today, it takes only 10 minutes. That means Matthew doesn't have to wait, worrying what the MRI might reveal.
I've had all the big surprises I need for this lifetime. I think we'll just call the rest of them off right now.
While MRI is able to capture the fine detail of blood vessels leading to and from the heart, it cannot yet follow the real-time motion of the heart itself. Blumke and his colleagues want to change that. They're working towards the day when just 30 minutes in an MRI scanner will be able to evaluate the entire cardiovascular system from head to toe.
Just look all the way towards your right side. Good.
If we diagnose disease earlier and more accurately, we'll be able to avoid a lot of pain and suffering in the first place. Advances in medical imaging are making even necessary procedures like screening for colon cancer pain-free. The American Cancer Society estimates more than 56,000 people will die of colorectal cancer in the year 2000. Yet there's a lot of evidence to suggest early screening can save lives, even prevent colon cancer. Traditionally, screening for this disease has involved cold probing steel and a camera. At Wake Forest University Medical School, Dr. David Vining has found a non-invasive way to look inside a patient's bowel, applying the same computer animation used to make Hollywood movies.
This is a 3D model of the colon, and we can literally fly inside to look for abnormalities.
Vining has combined information from a CT scan with a futuristic computer animation program to develop a way to travel through a patient's colon in virtual reality.
As we travel through this bowel, what we're looking for are lumps and bumps on the colon surface, looking for polyps and masses.
This new technology means doctors can now detect early signs of colon cancer without sticking anything inside the body.
The alternative to using a CAT scanner and computers to look inside the bowel would be this guy, an actual endoscope, which is inserted inside one of the patient's orifices, and then we look through a camera inside to see inside the body.
A non-invasive, pain-free alternative to an endoscope could encourage more people to be screened for colon cancer. With early screening and the clear relief of 3D imaging, doctors can save lives by detecting and removing harmless polyps before they grow into deadly cancers. At the Mayo Clinic, the latest high-speed spiral CAT scan technology is being used to screen for a number of often deadly diseases. CT, or CAT scan, stands for computed axial tomography. During a CAT scan, a special X-ray machine rotates around the body, imaging detailed cross-sectional slices, which are then stored in a computer. In many cases, patients are given a contrast dye that shows up as a bright white in healthy tissue. In just 10 seconds, this new high-tech CT scanner generates detailed high-resolution pictures. Less time in the scanner speeds up procedures. But more important, it means patients are exposed to a lot less radiation, and a CT scan is cheaper than an MRI. Dr. Stephen Swenson, the chief of radiology at the Mayo Clinic, wants to use this high-res, low-risk CT technology to stop the biggest killers in America from being so deadly.
We received a very generous grant from the National Cancer Institute of $1.6 million. And that grant is specifically to look at screening for lung cancer, trying to find it when it's that big, when it's very likely to be cured.
So far, the results are promising, and not just for people with lung cancer. Swenson figured while they were imaging the chest and upper abdomen, they might as well look for other abnormalities as well. So what began as a lung cancer study has evolved into a screening exam for other big killers like heart disease.
Breathe.
Just as Star Trek's Enterprise tricorder can scan the entire body with the wave of a hand, Swenson believes we can look forward to the day when a single machine will provide all the diagnostic information your doctor needs. in one scan, as easy as having her blood pressure taken.
It's not too outrageous to expect that sometime within our lifetimes that we will see a screening exam, maybe with MRI, maybe with CT, that starts at the stem and goes to the stern, that we can use as a mass screening for many of the diseases that cause death in America.
All right.
Breakthrough advances in 21st century imaging not only mean diseases can be detected earlier and more accurately, they also mean surgery can be done with more precision and less trauma to the patient. As medicine relies upon images instead of exploratory surgery to find out what is making someone sick, radiologists are taking on a whole new role. Interventional radiologists are not only diagnosing what's wrong, they're also fixing it.
So we just gently unscrew the needle.
These 21st century surgeons can perform life-saving operations with incisions as small as a pencil point. People who 5 years ago needed major surgery can now be treated as outpatients. That means faster recovery with fewer complications. For Alice Gray, it could also mean rescuing her kidney. Alice Gray arrived at the Mayo Clinic weak, sick, and scared. She's been admitted with a persistent fever and chills, and no one can figure out the cause. So her doctor has sent her down to radiology for a CAT scan. The radiologist on duty is Jeffrey Quam.
This patient was scheduled because she has a known infection in her hip, and they were worried that that infection from her hip might have caused an abscess in her abdomen somewhere.
Using the Mayo Clinic's newest high-speed CT scanner, Quam is going to search Alice's entire midsection for signs of infection.
Hi, I'm Dr. Quam, Jeff Quam. Are you feeling okay?
After giving Alice a contrast dye to illuminate all her healthy tissue, the radiology team starts the scan. As the CT reaches Alice's lower abdomen, Dr. Quam stumbles upon something completely unexpected. A dark spot in her right kidney.
Instead of it being white, which is from that dye that we gave in her vein, look at the one on the right now is very dark. And that means none of the dye is getting there, and in fact, it's as dark as the gallbladder, which means the density is just like water.
Just like water means there's a good chance Alice has a nasty kidney abscess. And tissue turned liquid by an abscess is dead tissue. Alice has a history of endocarditis, a bacterial infection of her heart valve. It's possible her heart condition is related to her kidney infection.
This patient's bacteria that were on her heart valve may have been pushed into the bloodstream out into one of the kidneys and actually nestled into one of the kidneys and caused a little kidney abscess. So this is a perfect example of something that nobody was really expecting, something that we can likely treat by putting a small catheter in there and getting some of that infection out of there.
A decade ago, an infection like this would have been treated with general anesthesia and major surgery. Today, an interventional radiologist like Jeffrey Quam can biopsy the kidney and drain the infection right here, right now, all on the CT scanner. Alice is relieved to learn they may have found the source of her misery.
Okay, all right, we'll be back in just a little bit.
But Dr. Quam says he's still not completely confident he's doing the right thing.
Just not something we do very often. Is that something that is a reasonable idea and is a fairly safe thing to do for this patient?
So he makes one more call to a kidney surgeon.
Go ahead and do that. Thanks for your help. Bye.
With the blessing of the urologist, Quam starts planning the procedure. Using CT scans to plot a course, he goes through the small of Alice's back so he can avoid puncturing the bowel and small intestine.
So why don't we mark her at I-304 on her right flank.
Unlike slicing open the kidney, passing a needle is non-invasive and safe. Still, the kidney is rich with blood vessels, so bleeding is always a danger. But at the moment, Alice says she's worried about something else. She says she's afraid she might have some kind of cancer. Dr. Quam tries to reassure her.
And in fact, if this turns out to be an infection, what we're going to do today will make a big difference in making you feel better, because we're going to take that infection fluid and pull it out of there. Your most important job during this whole thing is to let us know how you're feeling, okay?
No general anesthesia is required, so Alice can stay awake. That means Dr. Quam can talk to Alice during the entire procedure.
First thing we're going to do here is go ahead and numb up the skin.
It's time to begin.
A little poke with the needle.
The procedure itself should take no more than 20 minutes.
We'll go nice and slowly, so it shouldn't hurt you too much, okay?
Local anesthesia numbs the area where the needle is to be inserted. Dr. Quam sticks the needle in part way, then takes a picture to make sure it's in the right place.
So there you can see
He will use CT-generated X-ray images to guide him each step of the way as he aims the needle towards Alice's kidney. After inserting the needle, the X-ray tells him he needs to adjust his angle to reach the kidney.
I'm going to pull the needle back a little bit and aim it forward a little bit.
Apart from the discomfort of lying on her belly, Alice is feeling no pain.
Hold your breath right there.
After several minutes, Quam finds the long, angled path into the kidney.
All right, that needle tip is right where we want it to be. The next step is to see if we can get any fluid out of there.
But pulling back on the syringe, he can't seem to extract any fluid.
Well, it looks like it's solid and not liquefied, so what we're going to do is send the tissue for culture. And we're going to go ahead and put a small needle inside of this needle.
Using a long needle, he extracts several pieces of semi-liquefied kidney tissue. These tissue samples will determine whether Alice has an infection, and if so, what kind of antibiotic will work best to treat it.
Okay, I'm going to have you take a breath in for me again, Ms. Gray. Blow it all the way out. And another breath in, and just hold your breath there for a second. Might feel a little tug here. The needle's out, and you're all finished.
Oh, thank God.
You did a great job.
Don't too much, though, okay? Just let me get on my elbows. There you go. You can only release it a little bit now.
Duck soup. Didn't bother me. Prick, sure, but good Lord, how many pricks have I had in my life?
Lucky for Alice, her hip did not cause the fever. Lucky, too, they caught her infection early enough to treat it with antibiotics.
As time goes on, what is now solid kidney tissue that's infected with some bacteria, those bacteria will start to eat up the kidney tissue and turn it into just liquid.
Liquid tissue means dead tissue, which means a loss of kidney function. Given another week, Dr. Quam believes Alice would have needed a catheter to drain liquid from an abscess. Instead, there's a good chance antibiotic therapy will restore her kidney to full function.
And I'm glad I didn't have to have a tube and all that good stuff. So, isn't this wonderful? This is my happy day.
As future surgeries become more image-guided, surgeons will need a better roadmap to navigate the body. The technological challenge for medicine in the 21st century is to be able to simulate each patient's condition in the virtual world so doctors can provide better treatments in the real one. Dr. Elizabeth Bullitt is doing just that. She made her mark as the first female neurosurgeon at the University of North Carolina Medical Center at Chapel Hill. Now, Elizabeth Bullitt is attempting to make brain surgery safer with computer-guided images. To do so, she's teamed up with Stephen Aylward, a young computer whiz in the radiology department.
What Stephen has done is to write a program that allows you to define exactly where individual blood vessels are within magnetic resonance angiogram, or MRA, data.
MRA, or magnetic resonance angiograms, are images that illuminate the arteries as bright dots. Using these MRAs, their program creates a three-dimensional roadmap of each patient's spaghetti plate of blood vessels. This is what it looks like to follow a carotid artery in the brain, scrolling through a series of flat, two-dimensional MRA slices on the computer. With a simple point and click, this is the same artery rendered in 3D. This easy-to-use roadmap lets the user track individual blood vessels through the brain and inspect them from all angles.
And you can see how this looks from any angle of view, really like a mass of spaghetti. But if you start to color individual arteries or groups of arteries in a different color, you can see better what the relationships really are.
Working with Dr. Bullitt, Stephen Aylward has developed a kind of Nintendo game for untangling the brain's intricate web of blood vessels.
Sometimes blood vessels supply pathological lesions, and then you need to interrupt the blood supply to those lesions. But blood vessels also supply normal brain, and if you interrupt a blood vessel that supplies normal brain, your patient may have a stroke.
Mine crosses and comes back.
Yeah, it goes over, it makes this big...
For the first time ever, Dr. Bullitt is going to use her imaging program to plan a surgical procedure. Her patient, Gary Stevenson, has opted for brain surgery, hoping it will relieve the nerve-jolting facial pain he's endured for nearly 2 years.
If someone takes a frayed lamp cord and kind of rubs it against your face and plugs it in kind of thing, and it's just this current that runs from here to there.
Gary suffers from trigeminal neuralgia, a condition caused when the nerve that controls feeling in the face is somehow injured. For Gary, eating, drinking, and even brushing his teeth have at times been just too painful.
First go around, I had lost about 65 pounds.
Last summer, Gary lay in a hospital bed while doctors filled his bloodstream with pain medication, but nothing seemed to work. The pain grew so extreme at one point, Gary wondered whether he could go on.
You have to imagine someone who's goal-oriented, driven to 18 hours a day to accomplish things, to move forward. And I'm sitting for basically 2 and 3 months doing nothing because I feel bad. I'm in pain.
You are going to need...
Still, not knowing the cause of his pain, Gary sought out different specialists, including a dentist who suggested he talk to Dr. Bullitt. Having treated several cases of trigeminal neuralgia, Dr. Bullitt understood Gary's anguish.
I've had men come in with beards because they can't shave. I've had people who are housebound because they're afraid to go outside because the wind will hit them.
As for the cause of this debilitating disease,
I think we aren't sure absolutely. The theory at the moment is that an artery in the back of the head presses on the root of this fifth nerve just as it enters the brainstem and causes an injury to that nerve so that different small parts of the nerve talk inappropriately to each other. Okay. This artery is big enough and way over on the left that it's even pushing down on the brainstem there a little bit.
Bullitt believes that artery, called the basilar artery, is rubbing against the fifth cranial nerve, sending electrical shock waves through Gary's face.
These are the two carotids, and these...
Although she's performed this procedure many times, Dr. Bullitt has never before had the benefit of planning a brain surgery in 3D. And she can do it all on a home PC or laptop.
What this program will let you do is at home or in the office, look at the subset of vessels that you're interested in from any angle of view, let you figure out what your approach is going to be, what the relationship is of the place you're interested in to the other vessels, and really plan very quickly in 3 dimensions what you want to do.
To make her job easier, she color codes the different arteries running through the brain. In this case, blue for basilar and gold for carotid.
And these blue circulation in the back are the vessels we're interested in. And it's this big curving vessel that is the difficulty, I think.
Seeing those complex connections in full relief can prevent strokes during surgery by taking much of the guesswork out of surgical planning. 3D images can also provide valuable guidance during difficult procedures. This is the first time Bullitt is going to test her new program in the operating room.
Haven't lost one yet.
As Bullitt scrubs for surgery, she knows this could be a dangerous procedure because of the large size of the blood vessel pressing on Gary's fifth cranial nerve. Bullitt's first job will be to find the offending artery. To do this, she'll be guided with another powerful imaging tool, a microscope strong enough to clearly reveal minute nerve fibers. Without these magnified images, this type of brain surgery would not be possible.
We have a tiny opening. We've gone in this deep, and that would be a very deep, dark hole, and there are a lot of blood vessels down there.
It doesn't take long to find the large basilar artery, and just as expected, the fifth cranial nerve is splayed across it. With each heartbeat, the artery pulses up against the nerve.
Lordy, he's in a network.
Bullitt also discovers something she did not expect. The nerve is tangled up in a cluster of arteries and veins.
So the nerve is actually sandwiched between the basilar artery here and this vein here. And there's yet another loop of a vessel here coming from the side.
Even with the help of 3D computer images, Dr. Bullitt could not have predicted the artery was entangled in a big vein. That's because the MRA images she used to create her 3D map of Gary's brain revealed arteries, but no veins. Bullitt successfully maneuvers through an obstacle course of blood vessels and nerves. Once she reaches the artery, she uses a tiny piece of sponge to separate the nerve from the blood vessels wrapped around it.
Out of all that Medusa's nest of stuff, I think we got it.
The surgery appears to be a success, thanks to Dr. Bullitt's keen eye and steady hands.
I love the imaging, and I work with the imaging, and the imaging is helpful, but it doesn't replace being there, and to me, seeing it and touching it with my own eyes and hands.
Bullitt hopes her program will help surgeons avoid many of the hazards associated with delicate brain surgery.
What this kind of program means for both the patient and for the surgeon is that the surgeon is going to be able to have a much better perception of each patient's individual anatomy in 3 dimensions.
As technology advances, medical imaging will increasingly guide surgeons through a variety of complex procedures. And as Bullitt and Aylward move their innovation out of the laboratory and into the operating room, they hope their software program will also be used to map blood vessels in other parts of the body, like the kidneys and lungs. Major brain surgery did not hold Gary Stevenson down for long. Less than 3 weeks after surgery, he returned to work part-time. In less than a month, he was back to a full 55-hour work week, doing what he loves, managing a one-of-a-kind landscaping operation for roses.
I feel great. I'm doing better than I expected.
Gary is pain-free for the first time in almost 2 years.
I can go back to the way I was for the first 39 years of my life as far as being pain-free. It's kind of like getting a new, starting life all over again, I guess.
Breakthroughs in computer imaging are making surgery more precise by providing a clear roadmap to the body's internal landscape. In the 21st century, we will go beyond anatomical roadmaps and see cells as they grow. Exposing growing cancer cells before they become dangerous tumors can mean the difference between life and death. A difference 43-year-old Barbara Wells knows only too well. In 1999, Barbara found herself facing 2 life-threatening cancers. Less than a year ago, she was diagnosed with colon cancer. She went through a successful surgery to remove her colon. But during the procedure, her surgeon discovered the cancer had spread to her liver.
Hi, Miss Wells. How are you doing?
When Barbara first came to see Dr. Logie, a surgeon oncologist at Wake Forest University Baptist Medical Center, she thought perhaps her cancer was too aggressive to make her a good candidate for surgery.
Well, I had CT scans done in Greenwood, South Carolina, and they showed that there was tumors on my liver. They were thinking it was 3.
She had come with a scan that suggested that she might have a metastatic lesion in the liver, in fact, possibly several lesions. But we also had another scan that had suggested that all of these might be benign.
In search of a definitive answer, Dr. Logie ordered a PET scan, positron emission tomography, an imaging technique capable of seeing cancer cells as they grow. To Barbara's surprise and relief, the PET scan revealed 1 cancer tumor instead of 3.
To hear of 3 tumors, I mean, you're devastated. I mean, 1 tumor is bad enough, but when you're thinking you've got 3 and then if you only got 1, that's a relief. You know, you just praise and thank God for it.
Not only did the PET scan clearly identify Barbara's malignant tumor, it also provided Dr. Logie with another critical piece of information.
And also importantly, there was no disease outside of the liver, because surgery for people that have disease in the liver and also outside of the liver is ultimately not going to be very beneficial.
The reason PET was able to identify Barbara's cancer so clearly is that unlike other common imaging techniques, a PET scan provides vital information about how cancer tissue is growing, not just how it looks.
Basically, PET is a very high technology way of taking pictures of biological functions as are going on within the body.
Dr. Lee Adler was one of the first to apply PET technology to cancers other than brain tumors. PET imaging, he says, is the best way to screen the entire body for cancer.
Most of the other techniques that are used to look for cancer in the body are studying the body's anatomy.
PET imaging, on the other hand, can reveal chemical changes in the tissue itself. Adler says this functional imaging technology can detect abnormal changes in tissue long before those changes become large enough to cause a visible mass or enlarged organ.
Right now, PET is the only practical way that one can study living biochemistry within the body.
That ability to study chemical changes in the body makes PET a powerful tool for detecting cancer earlier and more accurately than ever before, giving people a much better chance of survival.
Let's see how much we have.
To detect chemical changes in growing cancer tissue, PET imaging uses a radioactive sugar manufactured right here at the PET Center. Because cancer cells are growing so rapidly, they need a lot more energy than do healthy cells. They get that energy from sugar.
There's no side effects from this material?
In this case, from the radioactive sugar injected in patients before they're scanned.
Nasal passages.
After getting her injection, Barbara moves through the scanner. As her body uses the sugar, a radioactive signal is emitted. A gamma camera captures those signals, which show up as hot spots on a 3D computerized PET image. This is how cancer cells in Barbara's tumor show up on her PET scan. Like cancer cells, the heart muscle also uses a lot of sugar and shows up as a bright spot on a PET scan. Although PET is uncovering cancer earlier and more accurately than ever before, it is not yet widely available to the public. And like a lot of people, Barbara had never heard of the technology.
I didn't know what to expect, what it was going to be.
When she found out what the PET scan revealed, Barbara says she was overwhelmed.
A wonderful procedure, and if my telling that it located and pinpointed the exact area that Dr. Logan needed to go in and remove the tumor, then I'm more than happy to tell the world it's a good thing.
Dr. Logie says PET has also revealed tumors other imaging techniques have missed.
But overall, I would say, especially for certain types of cancer, I think that the PET scan is superior.
You just relax the best you can.
In the 21st century, Logie says, PET imaging will not only allow us to expose cancer when it's small and more treatable, It also promises to help in cancer treatment itself. Right now, a treatment regimen such as radiation therapy must be almost completed before doctors can gauge whether or not it's done any good. With PET, Dr. Logi says, it's possible to determine whether a particular therapy is killing off cancer cells almost from the beginning.
Because it's a functional scan, we can use it in different ways, both for diagnosis, to follow up with treatment, and to help guide treatments. And I see your incision is all healing up very nicely here.
Because Barbara's cancer had not spread to other parts of her body, her tumor was removed surgically instead of with radiation. What Barbara and her husband Carol want to know now is whether surgery got all the cancer.
Told her that there are no surprises on the pathology. We did confirm that a tumor that had started in the colon had spread to the liver. The PET scan had suggested that there was only that one tumor, and that's basically all we found.
Dr. Logi says the surgery was a success, and Barbara's prognosis is promising.
There's probably better than a 1/3 chance of her being cured, and better than a 50% chance of being alive at 5 years.
Well, we're going to go home, and we feel like we have a new beginning, a new relationship. So it's everything that we asked for. It really is, and even more.
20th century medical imaging has made tremendous strides in answering the questions, what does the human body look like on the inside? And what does disease look like? In the 21st century, medical imaging will move beyond anatomy to answer the questions, how does the body work? And how do diseases grow? Those questions will be answered by looking deeper inside the body than ever before, as we study disease on a cellular, even molecular level.
There will be a need to move to the next level of imaging, what we call molecular imaging, mechanisms that will allow us to verify the success of gene therapy work, for example.
Adler says PET imaging can be used in genetic therapy because of its ability to visualize cells as they grow. That ability, he says, puts PET in the forefront of 21st century medicine itself, as new technologies such as gene therapy are developed to fight deadly diseases like cancer. In the future, someone like Barbara might receive genetic therapy before cancer cells ever start to grow. Until then, PET imaging can make the difference between hope and despair for Barbara and millions of cancer sufferers like her.
We hear cancer and we think death, and that's it. And sometimes we cave in and give up, but we're fighting it. We're going to continue to fight it, and we're going to stay on top of it.
With the power of computers, 21st century imaging is saving lives, monitoring illness, unveiling the mystery of pain. The precision of MRI reassures Matthew Kelly's family that he'll continue to keep his Marfan syndrome under control.
Each time he has an MRI, you're anxious to see how the results are. And each time they're fine, the next time's not quite as hard to, not as quite as anxious.
For Gary Stevenson, images revealing the source of his nerve-jolting pain have helped deliver him from intense suffering.
So what we will plan to do...
I want to think that this has given me another chance. And with that next chance in life, I'll do better than I did the first 39 years.
Breakthroughs in medical imaging are uncovering secrets within the inner limits of the human body. Secrets that will lead to revolutionary new ways of healing in the 21st century.